Good morning, good afternoon, good evening, wherever you are. Welcome to AI for Good, all year, always online. I'm Charlotte Kahn, presenting AI for Good Perspectives. AI for Good is a year-round digital platform where AI innovators and problem owners can learn, build, and connect to identify practical AI solutions to advance the UN SDGs. AI for Good Perspectives offer expert insights, global visions, and shared solutions from the AI for Good community. And today we bring you Sunny Dosanjh, Healthcare, AI and Data Leader at Deloitte UK. Hello, Sunny. Thank you for joining us.
Hi, nice to meet you, Charlotte.
So, Sunny, you're here to tell us about the Rita project. Tell us more about it and the healthcare problem you are trying to address and solve.
Yeah. So Rita uses AI to triage GP referral letters with the fundamental aim to reduce clinical admin to get clinicians focusing on their patients. Studies show up to 20% of clinician time is spent on admin tasks. We have a massive global and national shortage of clinicians. There was a recent study actually by the British Medical Association, which thinks the UK is 50,000 clinicians short. So you can imagine in less developed countries how big a gap we could have. In the UK alone, it takes about 15 years to get to consultant level. So when you put all of that together, we've got a huge problem. We've got a huge amount of demand, which is only growing, and we just don't have the supply of clinicians to get there. And so we need to use technologies like Rita, using AI, to help get rid of that admin burden and get clinicians doing what they do best, which is focusing on their patients.
Sunny, can you give us an overview of how the solution works?
Absolutely. So Rita uses AI to triage a GP referral letter. So that's primary care. So the hospital consultant doesn't need to. We don't aim to triage and automate that triage for all referrals. We only aim for about 40%. So in effect, if you simplify it, if you imagine a doctor gets 100 referrals in their inbox, what this would do is that they'd only be seeing 60. So we just make 40% of them completely disappear from that inbox. In the UK, the way we've done this is we've integrated with the e-referral system that the NHS has built. So we're able to extract the referral directly from the technical communication system so that we can then apply our technology. And what our technology does, it uses natural language processing and natural language understanding to extract the medical terminology. So it can do that in multiple ways. If you take the example of indigestion, indigestion could be spelt in over 100 different ways. It could be have spelling errors. It could be spelt in the medical term dyspepsia. It could be spelt in the layman's term of indigestion or even stomachache. You also see sometimes there's a negative, so it could say this patient doesn't have indigestion. And what our natural language processing and understanding is able to do is take all of that and give context to that symptom to really understand it. And then finally, once we've mapped all of those symptoms for that patient, we map that to a clinical model to be able to say, this is what the patient's likely to have. This is what the national NICE guidelines in the UK say. And therefore, we can then automate the action the doctor would usually take, i.e. put them in clinic A or put them in clinic B and set their priority level.
So what is the impact of the solution, the key benefits?
So the primary benefit is about releasing clinician time so they can focus on their patients. For every referral, our research indicates it's about 5 minutes it takes a hospital consultant to review a referral. So in England alone, that's about 1 million hours that doctors spend reviewing referrals. It's about 500 doctors in total. So if we can release that, that's 500 doctors that can be focused on the things that matters most to the patients, coordinating their care, seeing them face to face and dealing with them in the most effective way. But there are a load of secondary benefits too. So standardization, we align to national guidelines so that we can make sure there's no location lottery. No matter where you are in the country, where you are in the world, you get the best treatment aligned to your national guidelines. It's also faster. Usually, you'd wait for the doctor to get to this task. Doctors are busy people. They've got lots of things to do in their work list. They may not come to their referral triage for a couple of days, maybe even. What this does is the moment it hits the Rita inbox, we can triage that. It's automated, it's seconds at most before that triage is done and move to the next step. And finally, transparency. Usually AI is considered a black box, right? We usually think of it as this thing which decreases transparency. But in this rare use case, actually what we're doing is we're providing what is quite an opaque system. We don't as health authorities know where patients often are in the referral system. Have they been referred? What have they been referred for? What are they waiting to see in the hospital and so forth? And because of the way our tool works, we're able to not only be able to say that a referral has been made, but for what and what is the clinic they're waiting for, giving increased transparency to what is otherwise quite an opaque process for the health authorities to track.
And Sunny, I can imagine that developing this solution with an impressive set of benefits was not without challenges. So tell us a bit more about the key ones you encountered, but also what you've learned doing all this.
Yeah, absolutely. The two big challenges we've really faced is around clinical safety by design and explainability. In healthcare, clinical safety is absolutely first and foremost. All solutions have got to be clinically safe, otherwise they're going nowhere. We can't implement solutions that just aren't safe. The challenge is with AI is that all historic practice is not perfect. Clinicians are under enormous pressure. We're all human. We make mistakes. There's operational significant pressures, which means that sometimes you're not always following best practice. And on top of that, what's considered best practice is constantly changing. Now, this gives you a real challenge because the quality of your training data is constantly, therefore, changing. So this essentially gives you a challenge around training data because the data itself is not perfect. But also that data needs to be fluid because of that best practice continually changing. So we've had to continually redesign the solution architecture of our solution. We've trialed lots of things, we've tested it out, and we've then done lots of clinical safety assessments on the tool. And actually, to be completely honest, we fundamentally ripped the complete solution up multiple times and rebuilt it from scratch to ensure it meets the utmost clinical safety standards. The second one is around explainability. As an ex-medic, you're always taught you need to put your patients first. And as a result, that's what doctors do. We care about our patients. We want to make sure the tech we've implemented, we understand it and we know why it's doing what it's doing and what impact it's going to have. Now, in the AI community, that's really difficult in healthcare because often from machine learning based models and so forth, it's quite hard to build explainability. And so we've thought about multiple different ways to tackle that problem so that we're able to get our doctors, get our clinicians bought into the technology so there's enough explainability so they understand why it's doing what it's doing and understand what it's doing so they can get bought into it and so they can actually adopt it and use it effectively.
I think that's a very interesting point, isn't it? The fact that you need to convince people is also one of the challenges, I guess. Finally, Sunny, what's your vision for the future of AI and automation in healthcare?
Yeah, it's a great question. For us at Deloitte, where we focus most is around impact. There's lots of cool stuff going on in AI, particularly in healthcare. You see it in the papers, you see it everywhere all the time. I think for us, I'm a bit more boring, right? I'm happy to pick use cases which may not be the fanciest, may not be the sexiest, may not grab the headlines, but so long as they're making the impact, let's pick the admin tasks, let's get them out the way, let's get clinicians focusing on the things that matter most to them.
Well, Sunny, thank you very much.
Thanks, Charlotte. Thanks for having me.
Most welcome. That's it from us, but stay tuned for more AI for Good perspectives. AI for Good, all year, always online.